Hello friends and welcome to another video by Med Simplified. I'm Dr. Umar Malik and I hope all of you are doing well. In our previous videos on hair fall, we gained a lot of positive feedback. So in this video, we will talk about a drug so commonly used by men and women worldwide, yet is casually misunderstood. The drug we are talking about is minoxidil. We understand that hair fall is a very sensitive topic for a lot of us. It is so sensitive that people resort to various unproven therapies, expensive treatments and even hair transplant just to get their hair back. Before you get into all of that, do check out a video on the topic of why hair fall occurs and how to prevent it by clicking the banner above. Chances are that even slight modifications in your diet and habits, such as changing certain behavior, may have a drastic impact in delaying, if not preventing, hair loss. I'm pretty sure if you are experiencing some of the early signs of baldness, such as thinning hair or a receding hairline, you may have looked into minoxidil as a topical treatment for protecting your existing hair and stimulating the regrowth of hair. So now that you're here, let's talk about minoxidil. You will be surprised to know that minoxidil wasn't actually a drug developed for hair fall. Minoxidil was first introduced in the 1970s as an antihypertensive medication, taken by mouth, which is a drug that lowers your blood pressure. Coincidentally, physicians observed that hair regrowth and generalized hypertrichosis, that is, excessive hairiness, occurred in bald patients as a common side effect. This is surprising, yet interesting side effect led to the development of a special formulation for promoting hair growth, which was to be applied directly on the skin and scalp. At present, the FDA has approved the use of minoxidil topically for the treatment of androgenetic alopecia, also known as male pattern baldness, and also for female pattern baldness. Now let's talk about how does minoxidil work. There have been various studies to find out how minoxidil actually causes hair growth. In a summary, minoxidil works by shortening the telogen phase or the resting phase of your hair cycle and moving your hairs into the anagen phase, which is the active growth phase. Your hair goes through several distinct phases as it grows. Together, these phases are referred to as the hair growth cycle. This cycle is divided into three phases: the anagen phase, the catagen phase, and the telogen phase. During the anagen phase of your cycle, your hair grows to its full length. Research shows that 85 to 90% of your hairs are in this phase at any one particular time. On an average, the anagen phase of your hair growth cycle lasts for 2 to 6 years, during which your hair grows continuously. As your hair grows to its full length, it moves from the anagen phase into the catagen phase, in which the hair deattaches from your scalp. Next, the hair enters into the telogen phase, in which the entire hair follicle structure rests for several months. Finally, the old hair fully detaches and sheds from your scalp, with a new hair growing out from the hair follicle to replace it. This is where minoxidil comes into play. Minoxidil shortens the telogen phase of the cycle, meaning your hair spends a shorter amount of time at rest. It also lengthens the anagen phase or growth phase and stimulates your hair to enter into this phase earlier than they normally would. This, in theory, was further supported by further results of animal study in which minoxidil increased cellular DNA synthesis and caused enhanced cell division. Some researchers also believe that minoxidil works by widening the blood vessels inside your scalp and increasing the rate of blood flow to your hair follicle. These combined effects help to stimulate growth and improve the thickness, density, and overall appearance of your hair. Now you may ask, is minoxidil actually effective? The answer is yes, it is. In a 12-month study carried out in Germany, researchers found that 97% of balding men who used minoxidil daily as prescribed saw an improvement in hair growth and there was no worsening of their hair loss. Also, in a study published in 2004 in the Journal of American Academy of Dermatology, a group of dermatologists looked at the effects of topical minoxidil 5% or more than 900 men with hair loss. At the end of 12-month study, they found that more than 87% of the men reported that the medication was effective. If you look at the dosage of minoxidil, a normal dosage of minoxidil is 1 milliliter of liquid solution applied directly to the scalp 2 times per day, typically morning and night. Now let's look at how long until you see the results with minoxidil. Because of the minoxidil's mechanism of action, you won't experience immediate hair regrowth after you start using this medication. Instead, you may shed more hair than normal during the first few weeks of the treatment with minoxidil, as your hair rapidly moves through your hair cycle. This is normal and it isn't a reason to be panicking. Instead, it is best to keep applying minoxidil like usual. Most research shows that it takes a few months before you will notice any improvements in your hair after you start minoxidil. For example, the studies featured above, all of which showed positive outcomes, looked at the results of minoxidil after at least 3 months of regular use. Although results can vary from one person to another, you should generally expect to see some improvement from minoxidil after about 3 to 6 months, with more than significant results after a full year of treatment. In the meantime, it's important to be patient and continue using minoxidil, even if you don't notice any day-to-day change in your hairline. Now let's talk about how do you use minoxidil. The first step is to clean and dry the scalp area before applying the medication. You may apply this product on damp hair also. To use the solution, fill the applicator with a prescribed dosage. Part your hair in the area of thinning and apply the solution directly on the affected area of the scalp and gently rub it in. Allow the solution to dry completely before using other styling products or before going to bed. Do not use minoxidil on other parts of the body unless directed by your doctor. Do not use on the skin that is red, painful, irritated, scraped, cut or infected. Wash your hands thoroughly after application. Avoid getting the medication in your eyes. If this occurs, rinse your eyes with a large amount of cool water. Do not use this medication more than what is recommended by your doctor. Now let's talk about what are the side effects of minoxidil. Although minoxidil is a safe and effective drug for most people, you may experience side effects when you first start using this medication. As I mentioned earlier, you may notice increased hair loss during the early days of applying minoxidil, which is completely normal. Apart from that, common side effects of minoxidil include scalp irritation, dryness, scaling, and itching. It's best to talk to your healthcare provider if these symptoms are severe or don't go away on their own over time. Rarely, there may be serious adverse effects such as water retention, abnormal sexual function, a change in vision, abnormal heart rhythm, low blood pressure, dizziness, headache, and chest pain. Although you may read about a lot of claims about minoxidil being a wonder drug for hair loss, unfortunately, we still have not found a cure for hair loss. Minoxidil prevents and treats hair loss, but it is not a cure for hair loss. The effects of minoxidil continue as long as you are using this treatment. Once you stop, your hair growth reverts back to its original form. But minoxidil is safe for long-term use and you can continue using it to keep your hair fall in check. I hope I have answered few of your doubts and questions regarding minoxidil. If you like this video, friends, do consider leaving a like and sharing this with your friends. If you like what we do and would like to be a part of a channel, click the subscribe button below or become a member of our channel on Patreon or YouTube. With this, friends, we come to the end of this video. Take care and see you in the next one.